Okay, so when you're dealing with either neck, shoulder, arm pain, or in this case, like headache, face type symptoms, you've seen the retraction many times, right? In and out, in and out. That's a fantastic movement and helps a lot of people with lower cervical type shoulder arm pain, which is the most common. Now, what you could try, so that it can help for the lower, but also the upper if we do more of a sustained. So repeated is one thing, it's one choice of load. The other choice is to go ahead and just sustain it and hold it back there. Breathe. Keep the shoulders relaxed. Don't do this. Don't hunch up. Keep it relaxed. What that does is it puts the upper cervical spine on sustained flexion and the lower on sustained extension, which are the two opposite movements that we spend a lot of time in. So we typically are here a lot in protrusion. We're out here, which is upper cervical extension, lower cervical flexion. That's why this one works so well. Okay, so when dealing with thinking something like a headache, a cervicogenic type neck pain, you can start with repeated, but more likely you're going to have more benefit and more result with sustained. Now, even for myself, when I have like left-sided, like shoulder, chest, arm pain, I do better with sustained. Hold it 15, 20, 30 seconds. Breathe out. I can just feel that pain kind of melt away through my arm. So it just depends. Some people do better with on and off. Like, because if you hold it back there if you hold it back there and it's too sensitive, it can really like shock that arm pain, and you have to like do pressure on, pressure off, pressure on, pressure off. But if you're to the point where you know you've tested that, then go ahead and just hold it back there. Sustain, sustain, sustain. Work up to maybe 45 seconds to a minute, especially for headaches.